like smacking a certain presidential candidate's daughter for what she said the other day, which was that under Bernie Sanders' plan, he would abolish Medicaid and Child Health Plus and Medicare and the Affordable Care Act. And that's all she said. And I said to myself, so if you're an assistant manager and the company says they'd like to make you a manager, do you say, oh, I'm being fired? I'm not going to be the assistant manager anymore? Has my work not been good? No. You say, wow, I get a bigger job. I get a bigger paycheck. That's great. And I don't want to mislead anyone. I have not endorsed anyone in that race, but I still wanted to smack her. Well, her daughter. What would happen, the way it would work is all of those programs, Medicaid would be folded into New York Health, Child Health Plus, the Affordable Care Act, Medicare would be folded in, except that Medicare recipients, their providers would undoubtedly be paid more because they would all now be part of the same health plan that Michael Bloomberg's health plan. And there would be no deductibles, no co-pays. If you're in a Medicare managed care plan, you've got a restricted provider network, none of that. And so, now the mechanics for how we fold all those things in, in case you're working in that state health department, it will be complicated. But if you're a doctor or a healthcare provider or a patient, you won't have to know anything is going on. Folding Medicaid into the system is easy because we run the Medicaid program, and that would be that. We would technically have to keep track of which New York Health enrollees have low enough income to qualify for Medicaid so that we can tell Washington, you owe us 50% of this person's gallbladder, even though you don't owe us 50% of that person's gallbladder. Same thing for Child Health Plus. Under the Affordable Care Act, starting next year, states can apply to the federal government for a waiver that says we have a way to pay for health care that accomplishes all of the goals of the Affordable Care Act, but we feel does it better. Give us the money you were going to give us under the Affordable Care Act. We'll fold that into our program. And that's what we are counting on doing. Similarly with Medicare, ideally Medicare will agree to pay New York what it would now pay on behalf of Medicare recipients in New York. We'll put that into the New York Health Trust Fund, and people on Medicare will get an enhanced benefit just as the rest of us will. And some of that will be paid for by Medicare, but they and their doctors don't have to worry about that. That'll be in the magnetic strip on the back of their card. If Medicare does not agree to do that, there are still ways to incorporate Medicare into the system. One would be to have the New York Health benefit sort of wrap around Medicare coverage and pay for deductibles and co-pays and everything else. So the bottom line is we'll all carry the same card. The doctor treating someone who is Medicaid eligible will get paid as much as the doctor who treats George Soros or anyone else of wealth. And none of us as individuals or healthcare providers will have to worry about the mechanics of how that all happens. So every New Yorker will have at least the health benefits and the economic benefits that they now have, and virtually all of us will have an even better, in many cases a dramatically better